Well, humanistic therapy is quite different from both the psychodynamic and cognitive behavioral approaches to therapy. Humanistic approach, which I've touched on a little bit before when talking about some of those classic humanistic researchers like Abraham Maslow. Well, people can make choices about their behavior and are responsible for solving their own problems. So that's an inherent quality of the humanistic approach is respect for people, but also, people's own responsibility for their own behavior, their own actions. Already quite different from the psychodynamic approach, which it doesn't completely eliminate people of their own responsibilities, but it does tend to attribute people's negative behavior to their negative childhood events. Okay. Well, the person, the client in this case, it's called client-centered therapy. And the goal is to eliminate conditions of worth and to reach one's potential for self-actualization. So, eliminating conditions of worth basically means you're not trying to get patients to jump through hoops for you. You're trying to give them unconditional positive regard, make them feel good about themselves, increase their self-esteem, their self-efficacy, and therefore help them to reach their potential for self-actualization. So again, the basic idea is that people are good, so you want to just boost their already good thoughts and behaviors. Group and family therapy. Okay, group therapy involves, of course, people meeting as a group with a therapist to discuss problems based on that group. Okay, so you might have, of course, family therapy. I'll talk about in a moment, but other groups as well. Okay, so you can talk about Alcoholics Anonymous, for example. That's a very common form of group therapy. And family therapy, of course, focuses on the family and its dynamics. It can be very helpful to not deal with a therapist separately from your significant other. Rather, bring your significant other with you and deal with your marital issues with with your significant other. That can be very helpful. That's a key component of marital therapy and family therapy. Well, does therapy work? Okay, psychotherapy, well, it's effective for most people. Okay, I'm talking about all of these various techniques I've talked about, in general. It doesn't work for everyone, of course, especially if you have an extreme psychological disorder. But even if you're dealing with everyday issues, not anything particularly severe, it still might not work. It's going to depend on who you are as a person. Maybe it depends on your level of getting along with others, being able to establish a rapport with your therapist, being able to verbalize what's going on in your life. It's going to be based on those things. Okay, you really have to put forth a great deal of effort in a therapeutic situation. Certain types of treatments are somewhat better for specific types of problems. Okay, for example, the psychodynamic approach can help if there are clear childhood issues involved. The CBT, cognitive behavioral approach, can be helpful for a variety of anxiety issues. There's no single form of therapy that works best for every problem. It's really going to depend on the problem, depend on the person, the patient, the client, and the therapist, and how they get along, and so forth. Most therapies share several basic similar elements. Okay, so certainly one of those elements would be the therapist establishing good rapport with the patient or client, making them feel good about being there, and trying to provide some reinforcement. Typically is involved too, especially for CBT. Well, in the next segment, I will get into biomedical therapy, just a little bit about the biological approach to treatment.